everyone. I am Dr. Natasha Shetty, Senior Lecturer from the Department of Conservative Dentistry and Endodontics, Yenepoya Dental College. I'll be talking today about single visit endodontics. So I will be sharing insights on how to understand the concept of single visit endodontics and practical feasibility, to know the different treatment outcomes for a single visit endodontics versus multiple visit endodontics, and to know the indications and contraindications for practicing single visit endodontics. So to define single visit endodontics, it is a conservative non-surgical treatment of an endodontically involved tooth consisting of cleaning, shaping and obturation of the root canal system in one visit. So coming to the advantages of single visit endodontics, the first is the convenience for the patient and the operator. So the patient does not have to endure the discomfort of repetitive local anesthesia, treatment procedure and post-operative recovery. The efficiency of the treatment, the clinician does not have to refamiliarize to patient's particular anatomy or landmarks. Patient comfort, because of the reduced number of visits and injections, it is more comfortable to the patient. The fourth would be the reduced intra-appointment pain. Due to reduced chances of leakage of temporary cements, there are less chances of intra-appointment pain. It is economical for the patient and the operator. Extra costs of multiple visits, use of fewer materials make single visit endodontics cost effective for both the patient and the operator. Definitely minimizes the fear and anxiety, especially beneficially for patients who have psychological trauma and fear of discomfort. It reduces incomplete treatment. So some patients who do not show up once the symptoms have subsided, in such a case that is avoided, as this would be done in a single go. Lesser errors in working length. In multiple visits, chances of losing reference point due to fracture or grinding in case of flare-ups are more, resulting in loss of working length recorded. Restorative consideration. So in single visit endodontics, immediate placement of coronal restoration ensures a effective coronal seal and better aesthetics. Coming to the disadvantages, it is tiring for the patient to keep the mouth open for a longer duration of time to finish an entire procedure, especially in case of two canals or multiple canals, etc. A clinician may lack proficiency to do a single visit endodontics. If flare-up occurs, it is easier to establish drainage in a tooth which is not obturated. Another disadvantage is in some cases cannot be treated like in fine curved canals, calcified canals, multiple canals and teeth with weeping canals. So criteria of case selection would be, first is the competence of the clinician. Clinician should have the ability to perform all the steps of root canal treatment in a single visit without compromising the quality of the treatment. Second would be the positive patient acceptance. Patients should be cooperative and prepared for the single visit endodontics. Uncooperative patients, like patients who have health issues, especially diabetic patients or TMJ problems, limited mouth opening should be avoided in single visit endodontics. Absence of anatomical interference. Anatomical problems like presence of fine, curved or calcified canals require more than usual time for treatment. Teeth with such canals should be better treated in multiple visits than a single visit. Coming to the accessibility, so teeth for single visit should have optimal accessibility, that is a must, and visibility. So availability of sufficient time for the patient and the operator to complete the case in a single go. Coming to the pulp status, vital teeth is a better candidate option for single visit endodontics than a non-vital teeth, because there is a lesser chance of flare-up. Clinical symptoms. So teeth with acute alveolar abscess should not be treated in a single visit, but teeth with a sinus opening is a good case for single visit endodontics because the presence of the sinus will act as a safety valve and prevents buildup of pressure. So these teeth seldom show flare up. So indications for a single visit endodontic case would be first, as discussed, vital tooth. Then coming to fractured interiors where aesthetic is the concern, the patient will definitely need a single visit. Patients who require sedation every time, that will be avoided because of a single visit. Non-vital teeth with a sinus opening, non-surgical retreatment case, medically compromised patients who require antibiotic prophylaxis, physically compromised patients who cannot come to dental clinics frequently. Coming to the contraindications for a single visit. So patients who have a teeth with anatomical anomalies such as calcified of curved canals is a big contraindication. Also, if there is an asymptomatic non-vital teeth with periapical pathology and a no sinus tract. Another contraindication would be acute alveolar abscess case with a pus discharge, patients with acute apical periodontitis, symptomatic non-vital teeth and no sinus tract. Teeth with limited access will be difficult for the operator to try a single visit. Patients with allergies or previous flare-ups and patients who are unable to keep the mouth open for a long time, such as patients with TMJ disorders. So when we see the post-operative healing in a single visit endodontics compared to a multiple visit, so generally we feel that multiple visits have better healing because of the intracanal medicaments we place in inter-appointments. But studies show that the healing processing after any endodontic therapy will usually occur following an accurate diagnosis, proper case selection and use of skilled techniques of treatment. So it was found out that there was no significant difference in the healing rate whether you do a single visit or a multiple visit with infected root canals. The bone radiographic image and size of the lesion is the most commonly used technique to evaluate the healing, usually based on a PAI score developed by Ostravik. So I will read out the scores. So score 1 would be a normal periapical structure. Score 2 will be small changes in the bone structure, not a specific characteristic of apical periodontitis. Score 3 would be changes in the bone structure with mineral loss, characteristic feature of apical periodontitis. Score 4 will be well-defined apical radiolucency. Score 5 will be severe periodontitis with features and bone expansion will be evident. So based on these scores, we could evaluate the healing of the tooth post root canal treatment. Coming to endodontic flare-up and pain, so a number of hypotheses, some of which may be interrelated. They include microbial factors, change in periapical tissue pressure, local adaptation of syndrome alteration, effects of chemical mediators, immunological phenomena, psychological factors. So while coming to microbial factors, we very well know that irrigation protocol is a must follow, and a correct irrigation protocol would really avoid a flare up. Immunological phenomena, we know that our body will take time to react to certain external medicaments. So if there is a flare up, it is definitely the body's mechanism that is reacting, and of course the psychological factor matters. If the patient feels that a single visit endodontics wasn't sufficient enough, then they would always feel that multiple visit is better. So coming to the recent advances that will help us in performing a single visit endodontic therapy, these factors will aid in the easiness for the treatment for the operator and the patient. For example, using a microscope. Any form of magnification will of course enhance the procedure and give a better treatment. Use of apex locator so as to avoid multiple x-rays. An apex locator will be really helpful in determining the working length quickly. Use of guided endodontics. Crown down technique is preferred because of less chance of pushing the debris and bacteria into the periapical area, and also for easier preparation of the apical portion of the canal. Night eye rotary instrumentation, of course, over manual instrumentation is definitely going to aid in a quicker single visit endodontics procedure, and ultrasonics will aid in rapid canal irrigation preparation and effective bacterial removal. Use of sodium hypochlorite and hydrogen peroxide irrigants help in faster removal of debris. Newer methods such as thermoplasticized injectable gutta-percha can assist in rapid obturation. So, this is a chart comparing the single visit and the multiple visit. So, of course, single visit it will have one appointment, whereas multiple visit will take 2 to 3 appointments. And if there is a persistent infection, it will take more than 3 appointments. The process duration typically is 1 to 2 hours in a single visit, whereas in multiple visits, the appointment will last for 1 hour or more each time. Suitable cases for a single visit should be less complex with minimal infection or inflammation. In multiple visit, it is recommended for complex cases and severe infections. The convenience for a single visit it's definitely convenient as it is completed in a single visit. There is no pressure of remembering the working length and making sure it's up to mark for the next appointment. Whereas multiple visit, it is less convenient to the patient and the operator. Temporary fillings for a single visit is not required as the final restoration can be placed, whereas in multiple visit requires a temporary filling between appointment, which will cost more usage of material, and the more you open the canal and more it is assessed, there is more microflora exchange. Coming to the discomfort, in single visit it may cause less discomfort and there is no temporary filling, whereas multiple visit it is potentially there is more discomfort as the patient will tend to avoid eating from that particular side due to multiple injections and temporary fillings. The risk of reinfection is lower. Risk of reinfection is there in single visit, whereas there is a higher risk of infection due to temporary filling in multiple visit. In single visit, the healing process can begin immediately after the single visit, whereas for multiple visits, the healing process is slower due to regular opening of the canal space. Coming to the monitoring, limited opportunity to monitoring the healing process, where in multiple visit you can monitor the healing process much better and can address the complications. So to conclude, with the advent of technological advancement and emergence of new devices, evidence-based dentistry and more scientific deliberations, the concept of maximum dentistry in minimum visit led to popularity towards various protocols to enable dentists to venture into single visit endodontics with reasonable level of good outcome. So the case selection should be done properly, that has to be kept in mind, and thorough adherence to standard endodontic principles with sufficient x-rays and data with no shortcuts results in a successful single appointment endodontics. Thank you.